Welcome back. Today I've got a real quick scan review for you. I wanted to share with you just a quick review of this particular patient. So this is an iTero scan that we took a couple of weeks ago. The patient generally looks really good. We did order some Vivera retainers. There's a real small amount of shifting. It's not really perceptible, and that upper anterior crowding did not bother the patient. But what I wanted to show you really quickly was how I use this and the conversation I have with the patient. So we will either leave the iTero scanner in the room, and we'll actually be showing the patient what's going on the scanner, or I'll have this particular web screen up in front of the patient, and again, so we can show them. It's important to me that the patient can see what I see, so that as I'm explaining what they need and why they need it, it makes sense to them. One of my philosophies as I'm presenting treatment is to help them understand what they have, what the consequences are, and as long as they understand that, and then what I recommend as a solution, then I leave it in their hands. I don't want to put any pressure on anyone to do anything at any time. As long as they understand what's happening and the consequences of what's happening, they should have enough information to make a good decision about what to do and when to move forward. But that does fall on me to give them good information. Okay, so the only tooth that I had concern with in this particular scan was on the upper arch. So let's look at this tooth here real quick. Tooth number 2. So I'm going to turn on the photos, and there's actually a NIRI scan, which gives us infrared view as well. But just looking at it, off the top of your head, you wouldn't necessarily say that this is a tooth that's super concerning. However, to me, as I looked at it in the mouth, I was able to see, let's see if I can get the right angle here. There we go. So I was able to see what appears to me as a cavity. Now, some of you may disagree, and that's perfectly fine. I don't have any skin in the game, aside from informing a patient what I feel based on my experience and training. So my experience is this area is tooth decay. So what we're seeing, all this darkness indicates that there's tooth decay. Now, a couple of things you can see over here. Let me see if I can turn that up. You can't really see it super well. Sometimes the infrared will actually visibly make the decay show up as white if it's very close to the surface and very visible. But in this situation, so essentially I pulled this up in front of the patient. I'm showing them exactly what I'm showing you here. And the conversation I'll have with them is, you have a large silver filling. Well, it's not huge. Maybe it's a small to moderate size silver filling here on tooth number 2 on the upper right. This area that you see here is a corrosion byproduct. So that's the darkness that comes along when a tooth decay when a cavity is developing around a silver filling. There's some acidity that happens, and it creates this darkness, which I refer to as a corrosion byproduct. So what you see here is a cavity around an old silver filling. So my concern is, and this is again what I'm sharing with the patient, my concern is if this situation is left untreated, eventually it'll lead to one of two outcomes. Either a toothache or a broken tooth that may or may not be fixable, or some combination of the two. Now, what's the timing that might happen? What's the concern level? Really, it could be months or years before any of that happens. And honestly, I'll tell the patient that. Very rarely we run across a situation where any dentistry is life-threatening. Very rarely. Most of the time, things can wait. And many people will not like me saying that, but in my experience, things can wait. I mean, I've got things in my mouth that have waited a few years. I haven't died yet. Certainly, we want to minimize risk. And that's, again, something that I'll share with the patient. So, one of two outcomes: toothache, broken tooth that may or may not be fixable. What's the time frame? Could be months or years, but we want to try to minimize the risk to you to develop either one of those. So I'd recommend a crown and a core buildup as soon as possible. Now, anytime I treatment plan a crown, I always treatment plan a core buildup. Oftentimes, we'll get in there, we'll take the decay, the old silver filling out, we'll do the prep, we'll discover we don't need the core buildup, and then I get to be the hero and say, hey, you don't need the core buildup, we're going to save you some money. But that's really the only tooth that concerns me. Now, if we compare that area to tooth number 2 over here, you can see the tooth doesn't have that same display around the lingual, the mesiolingual there. The filling doesn't look perfect. There's definitely some stain around it. But with all this darkness that we're seeing here and the little white reactionary area around it, that indicates to me there's tooth decay. So that's what we treatment plan for this patient. just a crown and a core buildup, tooth number 2. Pretty simple, pretty straightforward. That's all I've got for this case review. Thanks.